Friends, in this video we'll discuss the sciatic nerve and a couple of branches of the sciatic nerve and a clinical application of one of those branches. Here's the piriformis muscle. The sciatic nerve appears just inferior to the inferior border of the piriformis. Very large diameter nerve, passes down the posterior thigh until just above the popliteal space, where it divides into the tibial nerve and the common peroneal nerve, or also known as the common fibular nerve. The tibial nerve passes inferiorly through the popliteal space, parallel to the artery and the vein, between the heads of the gastrocnemius muscle, passing inferiorly down the lower leg, and at this point passes between the flexor hallucis longus and the flexor digitorum longus, passes again parallel to the artery and vein. At this point, the tibial nerve passes all the way down to the area of the medial malleolus, and it passes posteriorly and inferiorly around the medial malleolus. We'll go back up to the bifurcation of the sciatic nerve. The sciatic nerve bifurcates into the tibial nerve and the common peroneal nerve, or common fibular nerve. Common fibular nerve passes laterally around the knee and comes almost in contact with the head of the fibula, at which point it's vulnerable for damage because of compression between some object on the outer part of the leg and the head of the fibula. The common peroneal nerve then passes to the anterior lower leg and innervates these muscles of the anterior lower leg: tibialis anterior, extensor hallucis longus, and extensor digitorum longus. The common peroneal nerve is depicted in this model right here as it passes into the area of these three muscles we just discussed. And if for some reason this nerve is damaged because of pressure in the operating room because of the way the leg is suspended, too much pressure of a steel holder against the head of the fibula here will compress this nerve for, say, 3 or 4 hours and essentially destroy the nerve. And in that case, this nerve is no longer functional, can no longer innervate these three muscles of the anterior lower leg, and as a consequence, the person cannot dorsiflex the foot. In other words, can't bring the foot up like this. That's called foot drop, and the person has to walk for the rest of their life by raising their knee much higher in order to avoid tripping on the toes.